I'm Dr. Konstantinos Chochlidakis, an associate professor and the program director at Eastman Dental at the University of Rochester. Today I'm here to give you a brief overview of what are the options for you if you're missing one or more of your teeth, or if you want to come to us in order to improve your smile. If you don't like your smile, or if you don't like the shape of your teeth, the color of your teeth, we do have the solution for you. When you come to us, we will go through your medical history, your dental history, we'll examine your teeth, we see what are your needs, and then according to our findings, we'll basically provide options for you. In order to change the alignment and the shape of the teeth, we do have aesthetic restorations such as porcelain veneers or dental crowns. And with these restorations, we are able to change at the same time the color, the shape, and the alignment of your teeth. Porcelain veneers are very thin aesthetic restorations that are bonded on the front side of your tooth. If you are not satisfied with the color of your teeth, we can do whitening for you. Whitening can be done either at our office, or we can provide the materials and the trays for you and you can do it at home. If you are missing one tooth, we have two permanent options for you. One will be the dental implant. A dental implant is a piece which actually is in your bone, and then on top we have a crown which is supported by this implant. As you can see here, a dental implant is actually placed in the bone, and then on top we have a connector and the crown which is connected on the implant. If you are missing more than one teeth, then we have to place more implants in order to hold the implant bridge. So basically, implant bridge is a bridge similar to a tooth bridge, but instead of using your own teeth, we use dental implants. As you can see here, this patient is missing 3 teeth. So in order to give him back 3 teeth together, we need to place at least 2 implants from both sides. And then on top, we make a 3-unit bridge, which is actually 3 teeth connected and supported by these 2 implants. If you're missing more teeth, but not all of your teeth, and you're not a candidate to receive fixed dental implants, then we do have a removable option for you, which is called partial denture, meaning that you can take it out. In general, if you're missing all of your teeth, we have several options for you. We do have removable as well as fixed options. We have also dentures that are held by dental implants. This is still a removable option, and now the denture snaps on the implants that we place, as you can see in this image. And the great thing is that more than 95% of the dental implants last for more than 20 years. These restorations are permanent, they stay in place, and they feel like your natural teeth. A smile makeover will totally change your life in terms of aesthetics, phonetics, function, and you will feel that you have your own teeth. So the satisfaction and the quality of life will significantly improve.